Bismillahirrahmanirrahim. Welcome to today's lesson on arteries of the orbit. The arteries of the orbit include the ophthalmic artery and its branches. The ophthalmic artery is a branch of the internal carotid artery after the vessel emerges from the cavernous sinus. It enters the orbit through the optic canal with the optic nerve. It runs forward and crosses the optic nerve to reach the medial wall of the orbit. It gives off numerous branches which accompany the nerves in the orbital cavity. Before discussing the branches of the ophthalmic artery, let's write them down. Alright, now we'll discuss these branches one by one. So first of all, the central retinal artery. This is the central retinal artery. The central artery of the retina, or the central retinal artery, is a small branch that pierces the meningeal sheets of the optic nerve to gain entrance to the nerve. It runs in the substance of the optic nerve and enters the eyeball at the center of the optic disc. Here it divides into branches which may be studied in a patient through an ophthalmoscope. The branches are end arteries. Number 2, the muscular branches. These are the muscular branches. The muscular branches supply the muscles of the eyeball. Number 3, the ciliary arteries. The ciliary arteries can be divided into anterior and posterior groups. This is the posterior group of ciliary arteries. The posterior group of ciliary arteries enters the eyeball near the optic nerve, while the anterior group of ciliary arteries enters the eyeball near the corneoscleral junction. Number 4, the lacrimal artery. This is the lacrimal artery. The lacrimal artery supplies the lacrimal gland. This is the lacrimal gland. Number 5, the supratrochlear and the supraorbital arteries. This is the supraorbital artery, and this is the supratrochlear artery. The supratrochlear artery and the supraorbital arteries are distributed to the skin of the forehead. Now, we have discussed all branches of the ophthalmic artery. Let's sum it up. So, the ophthalmic artery, which is a branch of the internal carotid artery, enters the orbit through the optic canal along the optic nerve. So, it enters the orbit through the optic canal. Then, it divides into numerous branches. The first one is central retinal artery. Then it gives off a lacrimal branch, which supplies the lacrimal gland. These are the muscular branches supplying the extraocular muscles of the eyeball. These are the posterior group of ciliary arteries supplying the eyeball. It crosses the optic nerve and moves towards the medial wall, where it divides into supraorbital artery, and it continues and finally gives off the supratrochlear artery. Before bringing this lesson to an end, you can see the supraorbital artery and the supratrochlear artery coming out of the orbit and supplying the skin of the forehead. Alright, this brings us to the end of arteries of the orbit. Next, we'll discuss the ophthalmic veins. Now we'll discuss the veins of the orbit. The veins of the orbit are the superior ophthalmic vein and the inferior ophthalmic vein. This is the superior ophthalmic vein, and this is the inferior ophthalmic vein. The superior ophthalmic vein communicates in front with the facial vein. This is the facial vein, and this is where the superior ophthalmic vein communicates with the facial vein. The inferior ophthalmic vein communicates with the pterygoid venous plexus. This is the pterygoid venous plexus, and as mentioned earlier, this is the inferior ophthalmic vein. The inferior ophthalmic vein communicates with the pterygoid venous plexus through the inferior orbital fissure. Now, both these veins pass backward through the superior orbital fissure and drain into the cavernous sinus. Now, let's summarize them. So this is the superior ophthalmic vein, which joins the facial vein over here. And this is the inferior ophthalmic vein, which joins the pterygoid venous plexus through the inferior orbital fissure. And both these veins pass backwards through the superior orbital fissure and drain into the cavernous sinus. This brings us to the end of the lesson on arteries and veins of the orbit. Thank you.